Good morning all and welcome to this Shield Safety webinar. We're just watching the numbers participants drop in, so I'm going to give it a minute or so because the numbers are rising rapidly. Bit of a gulp moment for all of us. So it's great to see familiar names from webinars that we have done previously. You joined us earlier in the year with Steve Alton from the BII when we were talking about the future, what to 2023 laid ahead for hospitality. Last month, we were joined by Andrew and the team from Net Zero Now, looking at carbon reduction. And today, I am really pleased to say that we have Jacqui McPeake and Dr Hazel Gowland talk about allergy insights and action, which is obviously particularly important this week, as it is Allergy Awareness Week. I do sense that I am amongst food safety allergen royalty today, to have Hazel as part of our panel. I'll introduce Hazel fully later and also Jacqui as well. So we are going to start with the royalty of allergens, and I'm afraid I will wrap up. I think my role here is probably the court jester, but I'll do my very, very best. As we see the numbers rising, we've had over 400 people register for this webinar, which I think is incredible, of which many will be joining today and many will be watching the recording afterwards. And I think this just demonstrates the interest there is in allergens, the need, particularly within hospitality and catering, to understand it better and what action to take, what is proportionate. And this is really important. At Shield Safety, we believe in making a difference. We really believe of having an impact, and with over 400 people joining us on this webinar today, we hope that each of you will take something back to your business, be it a single site operation, be it a multiple outlets serving hundreds of thousands of people a month or a year. So we really hope that you take something away from today. So what I'll do is I'm going to introduce Hazel Gowland first, who's going to kick off proceedings today, and we're still seeing the numbers dropping in as we speak. As I say, we're amongst royalty. Hazel has been part of the allergy awareness movement from the very early days. Her work with the anaphylaxis campaign in the early 90s, through to more recently her work, her PhD in allergy awareness and communications, and also being a visiting fellow to the medical school at Southampton University. We're really proud to say that Hazel is a technical advisor to Safe to Trade, and we really value her insight, her knowledge, her passion for allergens, which has helped us build a standard that we know is there to protect the consumer. So what I'll do now, I think Hazel is just loading up her slides. If they're working okay, Hazel, you can give me a thumbs up when your slides are there. Here we go.
Nearly there.
There is Hazel. So without further ado, I will hand over to the, dare I say, the Queen of Allergens. How does that fit, Hazel? And we're really looking forward. It's our pleasure to have you with us this morning. Really looking to hear about your update.
Thank you. Thank you ever so much, Rob, and thank you for inviting me. Yes, I've been asked to speak particularly about work I've done recently with Dr. Michael Walker. This is a paper that is open access, and we'll make sure that you have the link to read it. So for the last, whatever it is, 27 odd years, I have been an advocate representing the interests of people with food hypersensitivity, particularly IgE mediated allergy, like severe allergy. That's me in the olden days when I was 1 and I had my first reaction to peanut, actually, at that age. So I've lived with this a very long time, and anything I can do to make a difference to the lives of those at risk is important, and I can do it. Research, consumer behaviour, how are we coping when we're shopping, when we're eating out? I have key interests in fatal anaphylaxis and in the effectiveness of regulation, and I also support clinical studies. And then training, I've run Allergy Action since 2000, and I'll train anybody who will sit still long enough, particularly environmental health trading standards, public analysts, doctors, scientists, university students, and people in the food industry. And that's me. So that's my background. And I'm talking from a perspective of being involved in food allergy investigations right from the earliest days, back in 94, 95, when I was working with the anaphylaxis campaign, initially as a volunteer, and then later as the food advisor. We used to get phone calls saying this has happened, that has happened, or we would hear about fatal reactions. So my data are from a database of suspected or confirmed food allergies since 1988. So that's the furthest back it goes. And essentially that overlaps significantly with the University of Manchester UK Fatal Anaphylaxis Registry, which was established by Dr. Richard Pumphrey, and I contribute still to that registry. So supporting families following fatal reactions and supporting the investigations by coroners and the police and local authority officers. So that's been an involvement long-standing since the mid-90s. And then investigating and recording reactions and complaints since 1994, the beginning of the anaphylaxis campaign. So supporting consumers, working with regulators and listening to businesses and finding out what happened and advising them about how to make sure things don't happen again. And these are various publications. I think you'll have access to these slides afterwards. I'll send a PDF. So you can have a look at some of the references, but that's why I'm doing this and how I'm doing it and how long it's been going on for. Now, the first public effort we made, I know this is tiny writing and I'm not expecting you to be able to read it, but Dr. Michael Walker and I, Michael was the public analyst in Belfast for many years, and the first time I met him had anything to do with him. He was analysing curry samples taken from various takeaways for the presence of peanut when they'd been sold as peanut free. When we took this poster to various conferences, government chemist support was involved. So we took it to analysts and to clinicians. Essentially, it's 4 cases. So if you read across the 4 lines, so the first one was the tragic death of Thomas Egan in 2002 in a nursery where he was given milk in a cereal that he shouldn't have had. The next one was a civil action taken by the widow of a man who died at a wedding where he'd been given apparently egg that he wasn't expecting to have because that wasn't allowed in the culture, and he was allergic to egg and he died. The next one is the packet of chocolates, and they were sold on a market stall, and that was what I think we call grey market. So it's where it was imported and not labelled in English. And the last one was a textbook takeaway curry with peanut in. So those 4 sample cases were the first ones that we published and collected together to show that the law was starting to be used for these allergy food hypersensitivity cases. And then in 2014, we published a series of 8, so the 4 we'd seen before and 4 more. And we published them in a journal paper, which received quite a lot of attention, showing different kinds of law, different involvements of different parties in investigating and prosecuting cases. Whoops. And then the most recent paper, which is the one that we're focusing on today, is the forensic implications of food hypersensitivity. Essentially in January 2014, that was the end of our previous database series. And it was also where there was a key fatality where somebody ended up in jail. So that was why it was the starting point. And we stopped at the end of January 2020, mainly because that's when COVID happened and collecting data was all a bit turned upside down. So this is the latest paper. And we're talking about fatal cases and near misses and other reactions and complaints. And of course, we learn a huge amount from near misses. And we're talking about getting to the bottom of them. As you know, root cause analysis is absolutely vital. What actually happened? And of course, in many cases, we can't find out. It's very difficult to find out. But when we look at the behaviours involved, in many cases, there wasn't any avoidance. The person might have had their first ever reaction. They didn't know they should be avoiding. They weren't even trying to avoid it. They hadn't been told to avoid it. So obviously in that case, the law is sort of irrelevant, really. Sometimes they're avoiding the wrong thing. So they might be avoiding something that's cross-reactive with something else. Or they may have been misinformed, or they may not actually know what they're allergic to. Sometimes it's a domestic mistake, somebody gives them the wrong cup or whatever, so that can happen. And similarly, there can be little mistakes like that within the food business. Occasionally, there's a real non-compliance or even negligence. So you've got, some persistent behaviour where we're taking no notice of this food allergy issue. We might have been advised by our local authority, but we're not going to do anything about it. And of course, that's the tendency where you end up with people in big trouble. Just as background, hospital admissions. Now, this is 20 years, 1998 to 2018, of people going to hospital and being kept in. Now, most of us, when we have a bad reaction, we get stabilised, we get observed, and we go home. So admissions means that it's actually quite serious, and you can see the sort of purpley blue line at the top there is children 0 to 14. So there's definitely been a big increase, more than double over those 20 years. So people going to hospital and being kept in after an allergic reaction. That's the same graph on the left, but on the right in that box there, you can see that the case fatality rate due to food anaphylaxis is actually sort of dropping. So that compared with the number of people who are at risk, the number of people who are dying is actually going down. And in all the years that I've been doing this, I think the worst record we had was about 15 in about 2016 or 17. And that's 15 lives. But I think we can confidently say that per head of population at risk, the number of people dying is going down, which is good news. So back to January 2014. Now, Paul Wilson died on January the 30th, and he had had a curry, and he had asked for no nut. He'd actually asked for no peanut because he was allergic to peanut. And this is the docket that the police and the trading standards recovered from the takeaway. He knew he was allergic to peanut. He was very confident about avoiding, and he died. And when the investigation took place, it was discovered that a few weeks earlier, a young girl had had a similar reaction and nearly died. And the owner of the business, Mr. Zaman, had been warned and informed and advised and educated by both the local authority officers and the wholesaler for his products, that if he started using peanut flour instead of ground almonds, then he needed to make this known to his customers because it wasn't the same, and he needed to pay attention to people with allergies. So he was convicted of gross negligence, manslaughter. He was convicted of various food offences under 178 and the food hygiene regulations. Food was unsafe and injurious to health. He was selling food not of the substance demanded. He was falsely describing because he didn't change his menus when they were containing peanuts instead of almonds. And altogether, the food offences would probably have amounted to about 18 months on their own, but in the end, he got 6 years. And just to remind everybody that in January 2014, the Food Information Regulation was not yet enforceable. And curries and peanut are a long-standing risk back to 1988. So he appealed in 2017, and the appeal was rejected. His behaviour driven by money was appalling. The judges were wholly unpersuaded that a sentence of 6 years after a trial was manifestly excessive, and the appeal for the conviction and the sentence were dismissed. So we look at 3 young people in very tragic circumstances. We look at Chloe, and she had milk, which she was allergic to in the meat in a doner kebab, and she didn't know that they use milk in yogurt to bind the doner kebab meat sometimes. Natasha, who I'm sure you've heard of, who ate unlabeled sesame flour in the dough of a baguette, and Megan, who had peanut in Indian food when she'd asked for it to be nut-free. Those are 3 15-year-old girls, all on the threshold of life, who died from food allergy to different allergens. Now, one of the things that we've had more of in recent years since the Coroner's Act in 2009 is these reports to prevent future deaths under Regulation 28. So this is actually the investigation and the summary report about Natasha, about what happened to her when she got on the aeroplane and she'd eaten the baguette and so on. So the Coroner's Court is another source of data about these cases. And just a reminder, that's Natasha actually on the aeroplane during the reaction that she had. So another useful source of background information for the investigations. This is Owen Carey, who died in April 2017. He had milk. He was allergic to milk. He'd asked to have no milk. It was very clear. He and his family around him all made it clear that he couldn't have milk, and he got served buttermilk chicken. And you might have heard of the campaign for Owen's Law, and there's going to be a parliamentary debate on the 15th of May. Basically, understandably, Owen's family are determined that all the ingredients of all foods need to be written down, which in practical terms might be difficult, but that's what it's about. You can understand that. So what kind of offences have we got? Straightforward, Section 14 of the Food Safety Act. The food sold was not of the nature, substance or quality demanded. Or Section 15, the information provided with the food was misleading. Under 178, the food was unsafe because the information provided was incorrect. Under 1169, so the Food Information Regulation, the business had failed to highlight on the packaging or signpost, keep or make available information about the 14 allergens that are regulated. Under 852, we've got the obligation to do a risk assessment, and if people have not included the possibility of food hypersensitive people eating their food and put in effective controls, they can use Article 5 of 852. Then, of course, the Health and Safety at Work Act, dating back to 2002 with Thomas Egan, but also used in the Megan Lee case. And lastly, things like manslaughter. So that's the number of cases per annum going up during the study period, 2014 to 2020. You can see in 2020, we only had January and we had quite a few already. 68 convictions out of 70 cases. 1 in Scotland, 2 in Northern Ireland, 14 in Wales and 51 in England. And that's the breakdown of where they were. So in the Northwest, the Southeast, Midlands, Northeast, and then only 2 in the Southwest. So fairly evenly spread throughout England. Then we have which allergen was involved. You can see that peanut stands up, and you can understand that it's one that is very clearly causing problems, particularly in curries and that kind of food. And has caused quite a few fatalities. But then you have some people looking for gluten. So if there have been research projects, sampling projects by local authorities, we had quite a lot of work in Wales looking at egg in Chinese food, in businesses claiming to be able to eliminate egg, and they didn't necessarily do so. Then far over on the right, we've got general all allergens. So what about the penalties? Well, of course, there are fines, costs and compensation, so money. And these are when it's a criminal offence. And then sometimes the people in the business have no money and they end up with a community order. So many hours of community service. And I think we've had 7 people in total jailed, although some have been released on appeal. And then we've got the additional business risks. Now, my earliest civil claim that I've recorded in the UK was 1999. So people saying, you know, I went to your restaurant, you fed me something that I asked not to have, and I ended up in hospital. Please compensate me for my 3 days off work or whatever. Reputational damage, much more to the fore now with all the social media sources. And people sometimes, of course, are tweeting or recording on Instagram their reaction in real time. And then loss of business, loss of trade, and eventually perhaps loss of the whole business. I think it's worth reminding that although this is rare, Amy May Sheard had an allergic reaction which she survived, but it caused her significant brain damage, and she now has lifelong care needs. Now that happened abroad, and I don't think there was any action following the case, but it's a reminder to people who insure caterers that the potential consequences of an allergy mistake are extremely serious and possibly lifelong. And that is the end of my talk. I've got two adverts here on the right. There's a food allergens risk assessment toolkit, which is available online. It's an hour, it costs £25, and it's a really useful tool that I developed with my collaborator, Dr. Lisa Ackley. And underneath is the Institute of Food Science and Technology resource, the Food Allergens Knowledge Hub, which is obviously free and available and really quite a helpful resource for lots of people in this area. Thank you for listening.
Hazel, as always, that was fantastic. Thank you so much. Incredible taking the history and also the more recent statistics and the rapid rise in prosecution. So thank you for, as I say, your knowledge, your insight and your passion for allergies. It really was, it's first class. What we're doing now is I'm going to introduce Jacqui McPeake, just as we're loading up the slides. There we go. Jacqui is raring to go. What I should have mentioned earlier, we have Terry and Millie up in our offices in Manchester. They're running the webinar for us today, ably as they always do. We have a Q&A button, you can see that. If you have questions, please put them in there. I'm aware that we only have 45 minutes on the session. We may run over a little bit, but to be respectful of your time, we try and keep it on time. So if we don't answer your questions today, please do post them there, and members of the panel will get back to you. So what I'll do now is I'm going to hand over to Jacqui. Jacqui comes with a very, very strong background in catering. She brings that knowledge of catering in large-scale events and sites, and also a personal interest in allergens, much similar to Dr. Hazel Gowland. Jacqui is she is the founder of Jacqui's Allergen and Catering Specialists, and also she is the co-founder and director of Hospitality Allergen Support UK with Caroline Benjamin. We're really pleased Safe to Trade is sponsoring a forthcoming mock trial. You'll hear a little bit more from Jacqui. So without further ado, I'll hand over to Jacqui, who's going to talk about near-miss reporting, some more on case studies and the importance of clear communication. So over to you, Jacqui. Hopefully you're able to fly the slides. I should also say, Jacqui is also a hero like Hazel from the Free From Awards. So again, I feel slightly inadequate here. So you're both award winners from your work for the Heroes from Free From Awards. So over to Jacqui.
Okay. Good morning. Thank you for inviting me to join you on this session today. So as Rob has kind of pointed out, so I'm a joint director of Hospitality Allergen Support. So my background is working in the university sector. So I worked for 20 years in a large university in Manchester, 10 years as head of catering. And during my time there, the law changed on allergens, and I was conscious that my customer base, students, were actually the most vulnerable group because they were living away from home for the first time. Mum wasn't cooking, preparing or checking ingredients. So I took this back to my team, and we worked hard on communication and making sure that we encouraged students to talk to us and that our food was suitable for those with food allergies. So as I worked there for 20 years, and then I left to start my own business because my youngest daughter, age 14, quite out of the blue, really started with reactions to various food groups. So as a parent, I saw the other side. So now with Jax Limited, which is Jacqui's Allergen and Catering Specialist, I go out and share my knowledge of catering in large kitchens, small kitchens. I've been in all of them, but also to show the other side as a parent how difficult it can be, even with an intolerance, which can cause my daughter, to this day, she's 23 now, 2-3 days off work. It's not just an intolerance, which sometimes people think it's It's not as serious, obviously, as anaphylaxis, but it does disrupt her working life now. So with Caroline Benjamin, we founded HAS UK, which is Hospitality Allergen Support UK, which allows us to reach a wider audience because Caroline's based down in Southampton. I'm based in Manchester. So with campaigns, etc., we can reach a wider audience, and we work together and collaborate. And Caroline has her own business, Food Allergy Aware. So last year we collaborated with Greenwich University, and one of the students, a final year hospitality degree course, supported us with a project on near-miss reporting. Because we feel that before incidents happen, there's often warning signs, things happen within the business. We're all human, and near-miss incidents happen quite regularly. But what happens to those incidents is important. Within the health and safety world, near misses are automatically reported as a matter of course, and during a health and safety terminally or monthly meeting, it will be an agenda item. However, within near miss, within the hospitality industry, it's quite often dismissed, brushed under the carpet. Oh, it didn't happen, nothing serious happened. But this is a warning sign that something isn't quite right in procedures or in the policies. So we're encouraging hospitality businesses to look at near misses. So what is near miss reporting? Why is it important? And the importance of communication. So a near miss, the definition of a near miss is in an undesired event that under slightly different circumstances could have resulted in harm to people or damage to property, materials, or the environment. So as I've mentioned, good health and safety requires you to monitor your health and safety performance, and near misses are regularly reported of accidents and such like, and there'll be an investigation. But you know, this doesn't happen consistently across the industry in hospitality. And research has shown that for every 90 near misses, an accident will occur. So we need to take hold of that information, and the goal of near miss reporting is to address the incident and take action to prevent recurrence and remove the potential for fatal incident, perhaps. So prevention is better than cure, as we know. And in Natasha's law, they found that about at least 7 families reported to Pret a Manger that they weren't aware that sesame was part of the dough of the baguettes that they made in there, because it wasn't described on the label. And if they'd listened to feedback from customers, then perhaps we wouldn't be where we are today with Natasha having the tragic incident. So how do you define a near miss? And looking at examples in your business, from customers or from staff. So during our research last year, we had focus groups which included EHO officers. And in that call, EHO officers said we would rather that hospitality businesses would highlight a near miss because they know it happens. If I'd have served this, then something could have happened. But fortunately, a member of staff or a customer spotted that it wasn't the right food or the right ingredient. So they would much rather this was noted on paperwork, whether it's your food safety management system or in a special book or whatever, to show them and that you've done something about it, that it's been reported, investigated, and procedures might have been amended, because it does happen. If they see no reference to near misses, then they're concerned, because that's not accurate. It does happen. Whether it's just that, oh, I almost served the wrong plate, or I almost served the wrong coffee, but we realised just in time, it's worth noting because we can perhaps do something about it and alter the procedure. And also we asked food hypersensitive consumers, those with food allergies, intolerance and celiac disease, how do you respond to a near miss? What do you do? What does the customer expect? And we asked for examples of best practice. So we had 2 surveys went out last year, one to the hospitality industry and one to the consumers. Now, it's disappointing the hospitality industry, despite sharing on social media, several areas of social media, we got a very poor response. And the responses were from those that do it well already, and they wanted to highlight their practices. And they were from predominantly schools, universities, care homes, hospital sector. Those in the commercial sector were not so keen on sharing their information. And we found that those that reported good practices were coming from the managers, Those that reported not so good practices were coming from members of staff within the commercial hospitality sector. So they were reporting that they had nowhere to report incidents. One or two of them said they were actively discouraged from reporting. So that was quite disappointing, the lack of numbers. The second survey went out to the consumers, and we had a large response from those consumers. And that was interesting because the responses range from, we didn't know where to report an incident, so we didn't tell anybody. They reported to the Food Standards Agency and not necessarily getting a response or feedback. They reported to EHO, environmental health departments across the country. Some were better than others at investigating the incident and feeding back. Some were very good and got a full report, others didn't. So there's no consistency. And the venues themselves, again, were inconsistent. Some were very, very good, reported, gave feedback, you know, offered a free meal or a voucher to come back again. Some were not confident in going back to the venue, but the intention was there. But it was interesting that they weren't actually sure what to do, where to go. There's no clear information on that. And it kind of put them off going back to the venue, obviously. So what we encouraging is to have a form, an internal form or an external form, to describe how did this happen, why did it happen, and what can we do to prevent it happening again. So in your food safety management system, you will have a form for food poisoning incidents, where you will ask the customer what have they eaten, what time of day it was, etc., etc. So it will be a very similar form that we anticipate can be used within your system, just to note down all the information and actually do a little bit of an investigation to find out why it's happened. And you might find, as you gather this information, that there's a pattern occurring, which can obviously show that there's something wrong with the procedures, and you can change, you know, update your procedures and actually communicate back to your teams what's happened and why. As I've mentioned before, PrEP were warned by 7 different families about the potential risk, because the labelling at that time didn't highlight the ingredients. If they'd have listened to the feedback and recognised a pattern, then they might have highlighted this earlier and brought in labelling to highlight all the ingredients, obviously. So we recommend all near misses should be recorded and included in your paperwork and reported to senior managers. Whether it's a minor incident which was caught within the kitchen preparation methods, or whether it's actually during the interaction with the consumer, the customer, as you hand over the meal, somebody recognises it's a wrong meal, or the customer sends it back, it's the wrong meal. Whatever stage, it's important to recognise, and we don't want a blame culture. We want it to be something where they can feel confident in reporting this without feeling repercussions. So as we mentioned, you know, it is part of health and safety, it's food safety, and it should be talked about. Procedures updated, new procedures communicated, because if you update things, we need to tell the teams, and of course look at the patterns and trends. So when you're doing the investigation, Hazel mentioned this already, root cause analysis, it just helps you if you've got a procedure to follow. So you describe the incident when you talk to the consumer in detail, what time did it take place, so you can look at who perhaps was working in the kitchen, which team were on the front of house, categorise the incident, was it minor or severe, and kind of what was the cause of it. Was it the wrong ingredient? Was it the method of preparation? Was it cross-contamination, etc.? And how can we prevent it happening again? Do we need more training? Was the training in depth enough? Is it new members of staff who haven't been told what to do, etc.? And then obviously to review the process and update your documents. And there should be kind of, as I say, without to blame, because otherwise people just won't report it then. And good communication, what does good communication look like? Quite often communication, as Hazel mentioned earlier, is the cause of incidents. Front of house don't talk to back of house, vice versa. When recipes change, we don't tell the customer. So what we're looking for is reliability. We want to rely on the teams that the restaurants that we go to, and we want to trust them. So we want reassurance. So when we talk to the manager or the chef, we want assurance that, you know, they're going to do the best for our customer. They've got steps in place, procedures in place to prepare food safely. We want empathy. We don't want a dismissive, oh, it's just an allergy, it's just an intolerance, or, you know, a little bit won't harm you. All these type of comments are not helpful. Empathy about the situation, so that we get that trust there. And responsiveness, so that if something happens like a near miss, that the member of staff can deal with it. We want it to be a positive customer journey, because we want our customers to trust us and to come back. And we want, of course, we want to make sure that it's safe for them. So most food hypersensitive customers feel anxious when they go out to eat, because they're putting their trust in you. They want reassurance and a calm approach, showing the knowledge and understanding of the situation. They will appreciate that you will check the ingredients, reassure them. They want to eat in the knowledge that they're in safe hands, and of course that's your hands. When they're at home, they can control the ingredients and the food they eat. When they're out, they're trusting somebody else to make that food for them. If you can't answer the questions, refer to the manager in charge or the chef in charge in your business. You can't say, I think you'll be okay. If you're not sure, then of course you can't serve them. Make sure there are clear procedures in the business for allergen management. Understand the roles and responsibilities for all team members regarding allergen management. We can't expect the newest, youngest member of staff to know everything. We need to take responsibility, you know, higher up. And the importance of logging near misses. And Rob has already mentioned that Caroline, on behalf of Food Allergy Aware, is running an event which she's run previously. It's one day, it's in Birmingham, and it's a mock trial experience, and it goes through all the stages that Hazel mentioned in a trial. So there'll be barristers there, there'll be a witness, and there'll be we've actually got some guest speakers, and it's a really interesting day and very informative. So contact Caroline for further information. So that's a brief run through of near misses and what to do with them, and it's about thinking about have you got a process in place in your business. Thank you very much for your time and attention. Thank you.
Brilliant. Thank you so much, Jacqui. I'm aware as there's so much information in there, and the importance of near miss reporting and investigation. The 5 whys cannot be overemphasized. So thank you so much. I'm also aware it's going to be a little bit tight on time. We try and keep these sessions to 45 minutes because we're aware people may be going into lunchtime service. So I will do my best to fit my slides into the following 5 minutes, but I apologize if we do overrun slightly. We've got people are really good at putting questions in there, and I see Dr. Hazel is busy answering away. If we don't answer your questions now, what we do have is we have your contact details, and we will make contact afterwards. So hopefully now I've got control of the slides. He says nervously. There we go. So Rob Easton, as someone pointed out the other day, I look like a bouncer, but I'm here as Head of Environmental Health at Shield Safety. What I'm going to do is talk about research that we've conducted at Shield, led by Vicky Wood, one of our senior safety consultants, and a team of our amazing EHPs. And what we've done is we've taken the data from 2,000 allergen incidents, anonymised that data, and looked at trends, insight. What I'm able to give you from that is action that you can take away. We said right at the beginning, action you can take away from today to look at your business and can you make a difference. So I'll do a little overview of the insight, and this is the first time we've presented this data, first time it's been shared, so you're hearing it as an absolute first. And as I say, importantly, what does that help us understand, and where you can focus action in your business to take the greatest impact. So what I'll do now is what we did first of all is just look down a breakdown of cases by allergen, and it's probably no surprise for you in hospitality, you in catering there, that peanuts accounted for over a third of these cases reported. As with any data set, look, we know there's limitations with it. We know this represents just the clients we support. We recognise this is just a part of hospitality. It's not all food businesses, but still we think there's some valuable information in here. So you see it dropping from peanuts to gluten to milk to eggs, and then rapidly dropping off. Again, for those that are out there, this is probably very, very similar to what you're seeing, but this data just confirms that that's peanuts, followed by gluten, milk, and then eggs are the most significant cases of allergens being reported. So that's the overall breakdown of cases. Then what we want to do is look at severity, because obviously not all allergens are equal in the response that they have. And the two graphs that I'm going to show you now, the first one on the left-hand side, the pie chart there, looks at the total hospitalizations as a breakdown as percentage. And what we see of all of those cases that were reported, 71% of those that went to hospital related to peanuts. Then tree nuts, and you can see there's this huge drop then down to eggs, crustaceans, milk, and notably obviously there's some case of allergens that there were very few cases indeed, like lupins, and none of them were hospitalized. Now what we must say, and Jacqui made a great point earlier, is if we look at gluten previously, it was accounted for a fifth of allergy reports, but only a very small amount of hospitalizations. But please, I want to make it clear, the message from this session today is the gluten, it's just as important, but what happens is you don't have that acute response, that requires immediate medical care in most instances, but actually what you have with gluten is an impact on the quality of life that will happen for up to 4 to 6 weeks. I speak of a father of a son who has gluten intolerance, and we see the impact that it's not immediate, it doesn't require hospitalization, but what we do see is this impact on quality of life after that incident. The next graph I've got on the right hand side is around specific allergen incidents. So if we look at the total number of cases reported of peanuts, how many of those go to hospital? And again, it shows that reaction to peanuts and tree nuts is high. So we're looking nearly a quarter of incidents involving peanuts has resulted in that person, the consumer of that food, being taken to hospital afterwards. So what this says is, again, we obviously have the duty to look at the 14 prescribed allergens, but actually there's some here that account for the largest number of hospitalizations, the largest number of cases. So what I'm going to do on the next slide is I'm going to introduce you to the food value chain, and we consider with that information how we might look to manage allergens more in our business. And also we've identified hotspots. So this isn't root cause analysis, this isn't underlying analysis even. This is just the report that Vicky and the team have looked at to say, what was the primary cause? Now, again, we want to look at root cause analysis, and individual cases we do that, but this information I'm about to share with you gives a good oversight of what was the primary reason for that allergen incident in the business. And when we know that, what we can do is we can put in controls specific to that area. So I'm going to introduce you to the food value chain. Those that are familiar with Porter's value chain, you can see where we stole this from. So this looks at how food is added in value through the business. And it looks at the complete, and this is a simplified version of our model that we use with clients. It looks at the complete dish design, supplier approval, allergen identification. You'll actually see that the food delivery and prep is only a small part of that chain, right through to the delivery up to the consumer. And what we've identified is the hotspots in this food value chain where allergen incidents, those 2,000 that we've investigated, where are they? Where is it going wrong? And like I say, when we understand where it goes wrong, we can support with further controls. So the first one there at 21% is the matrix is wrong. So the information that's contained in that matrix that you're communicating those allergens to the guests is wrong. And we see this, I'm afraid, over and over again. When we're supporting clients, when we're auditing, this is, I'm afraid, only too common. So what can you do as a food business to address that? We look at one source of the truth. When you start multiple data entry, when you're taking allergen information from one place, putting it into a spreadsheet, taking that spreadsheet and then putting it into a consumer-facing document because it looks prettier, each time is an opportunity for a mistype, a misspell, a misentry of that data. So what we would say is always maintain that one source of the truth. And we're seeing increasing use of software to do that. That means there's one point of data entry, there's one point of communication for the guest, and it removes that human error. And actually only this week, I was chatting with Vicky, one of the large clients that she supports, and they've put over their allergen management onto a piece of software. and the impact has been incredible. And obviously we had the calorie labelling menu descriptions last year. What we saw was a move of businesses to greater use of this menu management software, and we know it makes a difference. Look at managing substitution and petty cash spend, being particularly hard over the last couple of years with supply chain challenges. But again, it's one thing, you manage your core supply chain, and then a side is off buying locally. They're popping down and buying a substitute product. So it's having a really, really robust method to manage substitutions, identify petty cash spending, and then draw that information, if it's allowed, back into that allergen communication. And also what we say is an independent review of a matrix. It's that independent view, and we do this many times, to pick up where errors have occurred, where people maybe haven't appreciated that there's particular ingredients within a dish, that reassurance that you've had an independent review of your allergy information, so you know what is going to the consumer is correct. So that's the first one, matrix is wrong. Next one that we're going to, if the slide progresses, so forgive me, is it's all around communication. And Jacqui, you covered this brilliantly, the importance of communication. And what we've identified here is that we had 10% of cases was the kitchen was not informed. It was simple as that. The communication that was taken from the front of house was not past the kitchen. We've then seen the wrong food delivered to the consumer. So what can we see here? We look at use of EPOS systems. If you've got EPOS, then you're communicating through the EPOS system that allergy information. That's really important, because heaven forbid, if there is an investigation afterwards, you've got clear communication on the till system that you can go in and extract. Back it up with personal interaction. Jacqui was talking about that. It is someone taking charge, that they take that allergy information, they go to the chef, they look them in the eyes and say, we've a check on, it's this allergy, and there's that absolute communication, confirmation that they're aware of the allergen. Clearly marking, segregating food on the pass, particularly important in C&B, where you're doing large conferencing and banqueting. There may be multiple plates that are up ready to go out, but how are you making sure that dish containing allergens has been, so that dish that is not containing allergens is separate, is marked, is clear which one it is. And again, we see it over and over again, that the wrong dish is simply served to the guest. And then identification when delivered to the guest. Now that can be delivery in a C&B, it can be delivery in a restaurant. Of course, really, really importantly, delivery when it is a takeaway. So making sure that that identification of the food carries on right through to the consumer. The next one we've got is allergy information not clearly communicated. I would hope, some of this data now, because it covers a couple of years, I would hope that this is dropping in frequency now. But what this does say is that communication to the guest is absolutely key. The consistent message to the guest, it forms part of your guest journey. One of the challenges, and Hazel's covered it off brilliantly in her paper when you read it, is about this vegan food. People are using vegan food if they do not want it to contain milk, fish and eggs. They don't want to make a fuss, so they're choosing from a vegan dish, but then it may contain, so it's not an allergen that is known to be there, but there's cross-contamination. So recognizing that people now, people that are hypersensitive to allergens, are using vegan dishes as a shorthand to believe that they're free from those allergens. And quite simply, the businesses are not managing the cross-contamination to a level to ensure that those dishes are indeed allergen-free. We need to make sure that menus are clear and other signposting is clear. We've heard from both Hazel and Jacqui today instances where the signposting, the menu wasn't clear. There has to be an absolute clear guest communication, guest journey that is understood by everyone. And then team actively engage on allergens. I was out with a colleague and a client earlier this week, and it was fantastic. We had a great lunch, but each time there was, is there any allergens have you any allergens on the table? Brilliant. We thank them for asking. As it was, there was none on our table, but it was just that reassurance. As we're there as consumers, we feel reassured and that they are taking allergies seriously. So team are actively engaged in allergens now. It's not a passive communication. And then overall, we've got some other small areas. Clients were informed, clients are aware of allergen. They didn't inform just a small part of 4%. Cross-contamination, I haven't talked a lot about today because we know that that's covered off well elsewhere. Maybe we can do a separate session on cross-contamination. But what I would say is overall, the business needs an absolute clear journey for the food, understanding how menus are developed, the supplier approval process, everything we have in this value chain here, and the controls that are in each part. So that forms part of your food safety management system. If you can, taking the lessons from health and safety, from risk assessment, is eliminate that allergen if you can early in the food journey. So when you're doing the dish design and specification, when you're looking at building dishes, does that allergen really need to be there? If we look at peanuts, there's a great example. We've seen that they are the largest cause of allergy incidents. They're the largest cause of hospitalization. Does that peanut, does that nut actually need to be in that dish? Can the mouthfeel, the texture, the impact of that dish be delivered by a different way, by using seeds, croutons, whatever it may be? And what we're looking there is managing the risk out early on, so you don't need to, or eliminating the risk, good health and safety approach, rather than having to manage it as an issue later down on the chain. So if you can, eliminate those allergens early in the food journey. A clear journey for the guests. So I've talked about the journey of the food, we've talked about the food safety management system, but we would say a business needs to absolutely understand the guest journey. So that's from the point of engaging, that might be websites, menu communication on websites, it might be your allergen policy. Absolutely understand that guest journey. You will probably have that guest journey documented already. What should they be feeling? What are their emotions? How do we market to them? What is the service steps? Is it table service? Is it order at the till? What are the steps in that guest journey? What we'd be saying is map then your allergen controls, your allergen communications through that guest journey. And why that's so important is, if it's part of your guest journey, don't think of it about being a food safety issue. It's just part of the guest journey, that it happens time and time and time again. Unfortunately, I've been involved in some serious cases where that guest journey was absolutely key. Did we understand? Did we take the information from the guest? Did we communicate back to them? And thankfully, we were able to prove in those cases that absolutely it happened, because it's just part of the guest journey. It's what happens for every single person, every single table sold. Training must be specific. We can do general allergy training. We can talk about the 14 allergens. We can talk about cross-contamination. But if you have your absolute direct food safety management system, if you have your guest journey, that needs to be trained to your team. They must understand it. That's what you do in your business, your controls. So generic training is good, it's great, it provides the basis, but team must know exactly what's expected in your business. And then with any process, with any management system, that's the role of audit. What we'd be saying is, if you've identified those absolute critical control points, that part of the guest journey that are absolutely the fundamentals of making sure you get allergy control right and allergy communication right, is how do you know that's happening? How do you know that's happening day in, day out in your business? And that's where audit can play a very, very crucial role, because it will feed information back into the business to take corrective action, or indeed celebrate when sites get it right. Obviously, there's the opportunity here with Safe to Trade. Obviously, Shield are very proud to be the first certification body for Safe to Trade. And indeed, as I've already mentioned, Hazel kindly contributed to the standard. And there is a key part of allergen control in Safe to Trade. And we would look, if you want to communicate to your guests about this premises that you're maintaining the high standards, communicate to the regulator, then of course Safe to Trade is a great way of communicating. Now, I'm aware we've already run 10 minutes over. It is incredible to see we have 165 people still watching this live, plus all those that are going to watch it later. So thank you to Hazel, firstly, for a fantastic session, followed by Jacqui. Both the royalty of food safety and allergens. You brought a great insight, information and passion for allergens. Thank you for all the questions that have been asked. And I see that people have been very quickly typing away there. If we haven't been able to respond now live, we will get back to you. Thank you to Terry and Millie up in Manchester, who have been fielding the questions and make sure that this all works. They will be sending out the CPD after this. We're pleased to say, not only is this a free webinar bringing together great presenters, it is a webinar that you benefit from CPD. And what I would say, I don't know if Hazel and Jacqui have just got a last word before I wrap up. They've both kindly come onto their cameras. Maybe they'd like to give us a wave, say a thank you. There we go, perfect. It just leaves me to say, have a very pleasant bank holiday. We've got 2 on the bounce. For those that of you are relaxing, we hope you have a great weekend. For those that are out there working, out in hospitality, we hope it's a prosperous bank holiday for you. But of course, you know we're going to say it, we hope it's a safe one also. So thank you for attending the session. We look forward to meeting you next month with another new subject. Go safely.